Serious, doctors of Reddit, what is the most disgusting thing you've seen on a patient's body? In medical school and was doing my rotation in the emergency department. I came in for my shift and the resident sent me into a patient's room to change their wound dressing. Easy enough. So, I went in there and I saw this dressing was absolutely filthy and smelled terrible. Apparently it had been on her burn wound for over 2 months because she was afraid to touch it. I carefully used saline and started unwrapping the bandage, which caused extreme pain. As I got a couple layers down, I started seeing things move and I thought it was me starting to get lightheaded from the smell, but I looked closer, it was thousands of maggots. Finally got to the skin, cleaned off all the maggots I could see, then returned 30 minutes later to see them covered in maggots again, meaning they had burrowed under the skin. During my CNA clinicals, I saw not one but multiple cases of hellacious nursing home neglect. One of the ones that sticks out was this poor woman who had multiple down-to-the-bones bed sores. The entire back of her pelvis was just missing, and you could clearly see her sacrum when changing dressings. Every bit of tissue from her heels was gone too, as was one of her elbows and one of her shoulder blades. She'd been left in the same position for weeks, ignored by the nurses because her illness was so severe she couldn't speak coherently and couldn't move at all on her own. In fact, nurses often sneaked into her room to gossip and watch TV on shift, treating her like a piece of furniture that occasionally made noise. One day when I was washing her face and brushing her teeth, her eyes actually focused on me, tracked my movements, and she smiled and tried to wave when I said hello. At that moment I knew she was having at least a semi-lucid moment. How many did she have while her flesh was literally dying on her body, and no one cared? The other one was when I saw a postmenopausal patient literally leaving a trail of blood down the hallway, running down her legs. The reason? She had dementia, and part of that was her masturbating frequently, often without noticing who was in the room. The staff at the home had quit trimming her fingernails, hoping the pain and injuries would make her stop. This was not the case. I quit working in the medical field after that. Was an intern at the time, working at casualty/emergency department. In came a male. Asked if he was homeless or not. He was aged around 50 to 70, can't remember. He couldn't pass urine on his own, so catheter it was. But first the little man down there had to be cleaned. Here's where the smegma came in. It was thick. Some of you may have it like in clusters. A little bit here and there. No. This guy had it like it was a scarf covering his thing. And the scarf was thick as a rope. You know the typical image of a girl in a snowy environment, wearing a snow cap and thick scarf encircling her neck? Just imagine that and correlate it with my story. I still remember it because that was my first catheter insertion. I threw my back out because cleaning it took a long time. I think he should have some abrasion with the way I cleaned his little man. Circumcised or not, clean your thing, guys. In medical school now, and I had a patient with a hole in their back the size of both of my fists together due to a stage 4 pressure ulcer. I would have been able to touch their spine while we were cleaning the wound if I had been so inclined. We took a massive chunk of necrotic tissue off of this guy, and the fellow I was working with said he would most likely die with the wound because it had gone so far. But nothing I can do can describe the smell. Even through an N95 mask and a surgical mask I was wearing, it was so overpowering that I still have nightmares about it to this day. The pimple was pretty bad. An athletic guy came in because his leg hurt during exercise at first, then at rest too. Nothing to see but a pimple on the thigh, and it felt oddly doughy. The pimple was the exit of a huge abscess. The whole thigh was filled with pus. The surgeon dove in with both hands, just hauling masses of pus and dead muscle out. Pilonidal cysts are similarly gross. Large abscesses above the anus from ingrown hair. The holes after cleaning those out vary from golf ball to grapefruit size and need to be tightly packed with gauze every few days so they heal from the bottom up. Takes a while, but they do heal. Homeless people were difficult too. Not that they can help it, it's difficult to keep clean when on the streets. But chasing vermin down the drain with shower spray at full blast is not fun. I always wanted to scratch my skin off after that. In med school I met a gentleman who the world had let down, homeless, disheveled, malodorous, and he wasn't quite there upstairs due to chronic alcohol use. Sweet guy but very confused. He said he came into the ED because his foot hurt. Covered in random scratches and bruises which didn't bother him. We suspected he had significantly reduced sensation from neuropathy. There are diverse types, e.g., alcoholic neuropathy, diabetic neuropathy. We put on some gloves. I extended his leg while the senior registrar removed his boot, and a chunk of his foot came off with it. Just a sizable chunk of heel. His foot was covered in necrotic tissue and the smell made my stomach turn. The old boot had been acting like a compression stocking, holding his foot together until it didn't. An old lady, like 80, got hit by a car at low speed. Had a penetrating tib fib that tore through the calf muscle, broken hip, and a bunch of other abrasions. In people that age, the mortality rate skyrockets to like 90% inside 12 months when there is a hip fracture, so her quality of life was significantly reduced as a result of that. A heroin addict punctured his eyeball when trying to inject it into the corner of his eye. My friend was an intern at that point and apparently it was his spirit killer patient. An older European man tried sounding with the straw from a WD-40 can and tore his urethra on the sharp edge. He was pretty chilled out about it, but his wife wasn't. If you're going to do some sounding, use a proper instrument with a rounded off tip. And for slam dunk grossness, a young man had visited a sauna, which is Commonwealth slang for a bathhouse where gay men go to have promiscuous thing. This guy had unprotected things with multiple partners and then freaked out he might have HIV. So, he came into the ED and wanted to get tested. Not important, right? Well, he was in tears and fearful and had a language barrier and so couldn't understand why we didn't need to test the ice cream container. Suffice it to say there is no biohazard bag thick enough to dispose of that, and chocolate ice cream was off the shopping list for a few months too. I've seen all those sorts of infected and odorous wounds, but by far the most disgusting, and saddest, thing I've seen in my career thus far, you know that green mold that grows on bread and rotting produce? In the ER recently, we peeled off a drunk homeless man's piss jeans to discover that one of his ulcerated legs was growing a lawn of fuzzy green mold. Imagine being so utterly mentally ill and addicted to alcohol that you've lost control over your body to the point that mold colonizes your skin like that. My heart is still broken by such a sight. Nurse here. Had an infant come in with intussusception, childhood illness where part of the intestines telescope back into itself, causing an obstruction, who was misdiagnosed and sent home. A few days later was rushed back to the hospital via ambulance because his bowel was so obstructed it has become necrotic and he went septic/started to die. Ended up resulting in an extensive bowel resection and abdominal surgeries, and during his stay in the ICU we had, what was left of, his bowel in a silo bag. A silo bag is essentially a plastic bag that holds the intestines suspended in the air outside of the body. The point is to protect them while outside the body so the inside can heal more effectively. It was like something straight out of Saw 3. The kid ended up making a full recovery. An anesthetist here. We were inserting a urinary catheter into an elderly woman. It smelled so foul, like some poor fish had died and been left baking in the sun for days. As the catheter went in, streams of brown pus started leaking out running along the catheter. Turned out to be a really bad UTI. Also necrotizing fasciitis, don't Google it. Med student here. Saw a guy come into the ER for dressing of a wound on his sole. The wound seemed like your regulation diabetic ulcer around 2 inch across, with a whitish floor. Then the resident put 3 of his fingers into the ulcer, and they went right into the man's foot, all the way up to the resident's knuckles. Turns out the floor wasn't the floor at all, but what was left of the inside of that guy's foot. Worst part. The whole time this was happening, the guy didn't even so much as wince. No sensation whatsoever. One guy walked home from a party and ran over the train tracks because it was shorter. He got hit by a train and his left arm got ripped off. Not just clean cut but ripped. To the part where you could exactly see where the vein was snapped. The worst thing was that, because he was drunk, climbed back up to get his phone and got hit by another train. That train just ripped both his legs off. We got him, still alive, because of the heat and pressure of the train. Your wounds are sealed, and he didn't bleed to dead. One leg ripped off above the knee and one under the knee. He was awake and cooperative and wanted to help move his legs, which he still thought he had. But it was just pieces of meat dangling. The guy actually survived, after a hard battle. Of course, without legs and that left arm, but he is an example for everybody. Plays tennis, ping pong, actually graduated. A family brought in their beloved family cat after it had been sitting under the couch for days. They only went to see what was wrong after the stench got too bad. The unfortunate thing was half scalped with an ear dangling off and the whole wound festering. That was the moment I knew veterinary medicine wasn't for me. I wanted to rip the people a new one. Staying friendly to keep people coming back with their helpless pet instead of them rushing off in a huff and not getting it any care is beyond me. Can't work with little children for the same reason. Teenagers, okay, they slowly have agency in their lives and there are resources to get them on their own feet. But abused kids going back to their parents would turn me homicidal after a while. I used to work in a secure psych facility for kids. We had a residential side and an acute side. We'd get kids in the acute side that were suicidal/homicidal all the time, or kids that attempted it. The worst is when you know 100% that the family is failing them, call CPS and they technically didn't do anything wrong. Parents can refuse helpful meds, rip kids off of psych meds suddenly causing huge issues, and just neglect with little repercussions, and I see the kid again in 6 months. Because the parents just don't care. We also had a lady drop off a low-functioning autistic boy. She lied about his function, and we were not a proper facility for him as he needed a nurse, not a psychiatrist, and she went on vacation. No number of calls could bring her back. She was gone for 2 weeks, and administration allowed it because insurance was good. It was hell because we just aren't equipped for that. Caused frustration for him and us. I've heard somebody. And while I loved those kids, I can't ever go back to doing that again. When I started the internship I had the choice between kids or teens. They were 2 separate, half-locked wards. Got to help a few days on each side and there was a little boy in the linen closet who did not dare to come out, and screamed like a dying animal when they tried to remove him. Staff would sit there and read him stories or tell him about how the day is going, leave food and very intensely not look when he snuck out at night to scurry to the bathroom. No amount of reporting and begging had any effect. He went back to his family. Hopefully, he remembered that people can be nice and get help later. But man, that was heartbreaking. I'd had enough right there. Teenagers are challenging in their own ways, but most of them went to assisted living homes and did pretty well there. Sometimes leaving home was really all it took. In the end though I stuck with adults, the surviving kids who were finally able to get help. This won't beat any of the maggot stories, but I love this story. I took care of this patient on multiple different admissions. He was an old man, who had been granted asylum in the U.S. because he was a political prisoner in his home country for advocating for democracy. Therefore, he didn't have any children or grandchildren here with him. The first time I had him, the nurse giving me the report handed me something in a specimen cup. It's his necrotic toe. He cut it off himself, he told us proudly, with a special knife. Because it was falling off anyway. When I went to assess his legs, I found that he had literally bound them in packing tape to keep the edema, swelling, from extending down to his ankles. He wouldn't let me cut it off. We eventually worked that out. Anyway, docs wanted to amputate, but he said no. Said he was an old man and after he finished writing down his life story, he would be ready to die, but he wasn't willing to live without legs. I haven't seen him in a long time, so he's probably passed away, but he always made me laugh. Very animated and very stubborn. I was a house surgeon doing my surgery posting. We had a diabetic patient with a case of non-healing ulcer infested with maggots. An absolute pain to remove. Used over half a liter of turpentine but still a few stubborn maggots were left. The patient was a security guard somewhere and apparently had spent some time in stagnant water a couple of days ago, which probably caused the infestation. His leg ultimately did survive after extensive debridement, but definitely one of the most disgusting things I've seen. Anyone know what a diabetic foot is? People with diabetes often lose sensation in their feet from neuropathy and are prone to injury, which ulcerates and can become infected once they don't feel the pain to tell them something is wrong. As a medical student, I walked into a room and was immediately hit with the scent of rotting flesh. This person had a diabetic foot ulcer that had eroded down to the bone and was just about the foulest thing I had ever smelled. Patient wouldn't let me examine their feet. Attending comes in and takes the socks off without even thinking about it during the exam, and as the sock comes off, a cloud of dry flaking skin explodes into the air. As a student, I was able to nope out of their stat to avoid inhaling whatever that was. Looked like a combination of fungal infection with poor circulation causing the entire foot to be a scaly flaky mess. Pap smear on an obese woman who clearly can no longer reach her hoo-ha to clean anymore. There was certainly a yeast infection as evidenced by the thick cottage cheese-like material filling her vaginal vault and clinging to the walls. But there was also a collection of thin mucus-like fluid pooling in the vaginal vault. And the smell? Just lovely. Surgery module in medical school. I'm overnight with the surgical night team. Get a consult call to ED that patient has a chest injury. The attendant, the resident, and I go to ED to see the patient. As we approach the curtained-off area where this patient was waiting, the smell gets worse and worse. We enter the curtain, and it smells like rotten flesh mixed with the foulest feces you can imagine. The guy has gauze over a section of his chest. The attending lifts the gauze, and we see a well-healed but open penetrating injury to the left chest wall. It seems he had been shot many years ago and the wound never healed, and he never followed up with it afterwards. You could see his lungs, and if you looked at the right angle, a little bit of the heart beating. The attending took one look at it and said the words I will never forget to this day, "This is beyond the scope of my practice." And he walked out. I'm not sure what the next step was after that, probably CT surgery consult, but we were not taking on the case. I have more, but these are the ones that jump to the front of my mind. Obviously, not a doctor, but I work directly with patients all over the hospital. The other night, I was doing my rounds, checking on my patients, and I had to spend a considerable amount of time with one particular patient who had a roommate. The roommate slept with his mouth open the whole night, which isn't a problem. Except all his teeth were rotting inside his mouth. Every single one. I can't even begin to explain the smell, but it was by far the worst I had ever smelt. I started getting irritable and agitated and actually angry just by the smell, and had to remove myself quite a few times to take some deep breaths outside. I still feel like I can smell it a few days later and gag occasionally when I think about it too hard. During graduate school, I shadowed a reconstructive plastic surgeon. We tend to think of plastic surgeons as catering to the rich, helping them smooth their wrinkles and enlarge their breasts, but reconstructive surgery is a lot more gnarly, and is about repairing damage from injuries and illness. A few things that came to mind: bed sores. Oh God, the bed sores. These are mostly on overweight or para/tetraplegic individuals with chronic conditions who aren't well cared for and lie in one position for too long. Imagine someone took a chunk of flesh out of someone's butt or thighs with an ice cream scoop, then let it fester. One patient had lost most of the flesh of their calf in a car accident, so the surgeon had taken a graft from there but to replace it and connected it with a single vein/artery combo to allow blood flow. It was like someone had sewed a 16-ounce steak onto a thin layer of muscle over bone. One diabetic patient's foot had rotten down to the bone, which had become infected. They were desperately trying to save the foot from amputation, a battle they were sadly losing, but it looked like something out of a zombie film. My mom worked as a nurse in an ICU for decades and used to tell me all sorts of stories about things she saw. Since she dealt with pretty serious trauma injuries on the regular, it took a lot to sleeve her. One story in particular that always stuck with me, which happened a while ago, I think the late 80s/early 90s, was a massively unfortunate case of a hit-and-run with a homeless man. They weren't sure how long this poor man was left lying injured, but they thought it had to have been a couple of days. Uneasy face. The thing is, due to the man's poor hygiene and open injuries, he was actually full of maggots. And that's not the grossest part. Maggots really only eat dead/necrotic tissue. So, they elected to leave the maggots alone. Once they got the man stabilized and his infections cleared up, they lured the maggots out by leaving a strip of bacon under his nose and they all came squirming out. It's my understanding that the patient lived, though my mom had no idea what happened to him after he got discharged. But, yes, I think about that story a lot. It's almost urban legend level of unreal. But it apparently is common enough to be referred to as maggot debridement therapy vomits. Used to play an MMORPG and the guild leader was a nurse practitioner in the US. She used to play at work, so we were used to pausing raids for her because she was mostly in an admin role and it was a small town, so she'd only be gone 5 out of 10 minutes. She shared some amazing stories, people nail-gunning their hands to wood as an example, but usually nothing major. One particular day she didn't come back. We knew it was possible, medical professional and all that. Turns out hers was the nearest clinic to a man's failed shotgun suicide, barrel under the chin, and all he did was blast his face. She had one nurse holding literally his face together whilst she was intubating, and the doctor did whatever the hell he could. Don't envy anyone involved in that entire process. Not much bothers me after 2 decades of this. I don't like airway secretions, mucus particularly in tracheostomies or endotracheal tubes, and I really don't like the smell of melena, bloody stool. But the stories that seem to bother my friends and family the most involve old wounds and maggots. I work in a wound care center. We see a lot of diabetic foot ulcers or quadriplegics with severe pressure ulcers. They can be present for months or years and often initially come in with all sorts of nasty stuff in or stuck to them. Maggots being one of the more benign things from my standpoint, but they never fail to gross out someone. This is my grandmother's story. She is not a doctor but a receptionist who takes appointments and looks at x-rays at a dental clinic. Anyways, this guy walks in, and he wants to get his teeth cleaned as he states that he's feeling pain around his back molar area, nothing unusual, just signing in for an appointment. When he gets into the chair, they take an x-ray and process it. It gets to my grandmother, and they notice something weird in the guy's gums. Dr. Blake, not his real name, is using the tools in the guy's gums. He pokes around and pulls out a maggot. It wasn't big, but it was alive and disgusting. The x-ray showed that he had 4 of those type maggots burrowed in his gums. My grandma said it was the nastiest thing she's seen in her line of work. I took my sister's daughter to work one day. This 25-year-old man with his kid came in. They were both lovely. I called in their name, so they came in, and my sister's daughter was extremely interested to see what the injury was. The man pulls up his sleeve and there was blood and burns everywhere. Somebody had set his arm on fire. I was horrified. We had to send him into the ER because he needed to be helped by professionals, which I am one. It was horrible and I still have vivid images. not a doctor. Even with the best insurance and the world's best surgeons, it comes down to a few factors. In cases like this, how damaged was the arm if it was found? It is too damaged, or the limb has started to die, then it cannot be put back. The area itself is too damaged even after being cleaned. Sometimes if the arm was detached and it's shredded, then it's no longer able to be attached. Had a high chance of being rejected. This happened even it is your own body. After all this surgery and care, there still is a possibility it will have to be removed again. I will assume there are other reasons that can also be on play, but from having family having limbs and parts accidentally removed, usually these are some reasons why either it could or could not be reattached. The human body is an amazing mix of incredibly durable and surprisingly fragile. One person trips, whacks their head on the ground, and dies instantly. Then there's Vesna Volvic, who fell over 6 miles after the plane she was on exploded and eventually went on to make a near-complete recovery. She walked with a limp afterwards. A disturbing amount of life is determined by luck, both good and bad. My husband had a pilonidal cyst that got inflamed and became necrotizing fasciitis. He lost a buttock and some thigh meat. 4 or 5 surgeries in 2 days saved him. I had to be taught how to pack his wounds before he came home. Talk about intimidating. It didn't gross me out, but it pained me that in one section, it was almost open to the coccyx bone. It's a terrible disease that's happening more frequently.
Thanks for watching. Please comment, like, share and subscribe. The Internet Surfer on YouTube for more horror and scary stories.